Welcome everyone. With protocol already established, good afternoon to everyone joining us in person and also virtually. This is a very momentous event. We have come a long way to get where we are today, working with Community Health IT, Dr. Seiler and her team. But I would like to take this opportunity to acknowledge my Medicaid staff that's in attendance. Um, uh, Ms. Laura Diane Denning, our Director of Operations, Ms. Carla Huggins, our Claims Supervisor, and just to let you all know, an upcoming superstar in the Medicaid program, Ms. Dahlia Richardson, who's a superstar in her own right, with handling provider enrollment on her own for many years, with the Medicaid program when everything was done manually and by paper. And now, we do have the Medicaid Management Information System, or the MMIS, which we utilize to enroll our providers. And in addition to that, Dahlia has been the main point of contact, working with ComHIT to get this message and word out to you about the surveys and this event. And also, well, Beverly Joseph is not with us today. She's still out on medical leave, so our prayers continue to be with her as she addresses her medical challenges. And I also want to just thank my entire staff for the untiring and tireless time that they place in addressing the increase in demand for access to healthcare services with the limited resources and staffing that we have. I'd also like to acknowledge Dr. Seiler and her team. As I mentioned before, we started working with Dr. Seiler, over a year ago, to try and make this happen, and we're finally here, and we're moving like gangbusters. So thank you, Dr. Seiler. Michelle Francis, who just provided the opening remarks. Michelle has been a very critical partner to the Medicaid program while she was at the Department of Human Services, and now in her new role at the Office of Health Information Technology. Dr. Sheen, I would also like to thank you for your continued support and advocacy for the program. And also Commissioner Kazi Gomez, who has provided leadership, in ensuring that the vision for the program is achieved success. Commissioner Gomez and I had some very productive meetings here at the National Association of Medicaid Directors Fall 2021 conference. So a lot of good information to share when we get back. And last but not least, my Assistant Commissioner Reimer Brown, for her continued guidance while we, work with this very huge, massive program. So, and I would be remiss if I didn't say, no pun intended, but the reason for this environmental scan took us quite some time to get connected and get going because of technical issues. And this is the main focus of an environmental scan, to ensure that our providers, your systems are, the capacity, the capability, for your systems to eventually connect to our health information exchange, which is going to transform the way that we provide healthcare in the territory. It's going to be a transformational event for all of our healthcare facilities, for our physicians, for our partners and stakeholders, and also, most importantly, for the members that we serve. our most vulnerable population in the Virgin Islands. This scan will let us know, what changes and or enhancements need to be made to your systems to get us to where we're going. We also know that, at the completion of this scan, the results will tell us exactly that. And it's something that's mandated by CMS. So, it's very achieving for us to be here at this point. Now, I'm going to stop talking. I'll be short, but I need to introduce my director of operations, who came to us from the state of Florida. Um, Diane came to us and she had interviewed for one position, but we found that she would be a greater asset serving in the position that she's serving now. A very committed, very hardworking, and takes initiative. I don't have to ask or tell Diane what to do. She comes and tell me what we're gonna do. So without further ado, I'd like to introduce Ms. Laura Diane Denon, our Director of Operations, who's going to provide Commissioner Kimberly Causey Gomez's remarks. Enjoy the rest of your afternoon with us. Enjoy the food. And, let's, as Michelle said, we have to be able to do this together. No one agency, no one person is going to be able to achieve success for us to be able to do what we need to do, and that's to transform how healthcare is going to be provided here in the territory.